This session comes from the Department of Surgery at Duke University. It's entitled Gastric Bypass Surgery Restores Meal Stimulation of the NX-Orogenic Gut Hormones, Peptide YY, Glucagon-like peptide 1 independently of caloric restriction, and is being presented by Dr. Alfonso Torquati.
Nice to meet you. Thank you.
Okay with all this.
Right. These are my disclosure. Now we know definitely that from the talk we had before that bariatric surgery is metabolic surgery. There is more about, really weight loss or change in adiposity. There's a lot of change that can really explain what we see in our patients. And our lab has been very interested definitely in the diabetes resolution, but also in one thing that a lot of surgeons know about from their patient. They change the way they feel, satiety after bypass, bending, or sleep. Now, the traditional view of weight regulation essentially is based on a balance between energy intake and energy expenditure. But a new view that has been based on really the last 20 years, when there's a lot of study, really weight regulation should be based on 4 components: brain, gut circulating signals, caloric intake, and body fat store. This is also called the adipostat. Now, the key question, how bariatric surgery really overcome this adipostat and induce significant and prolonged weight loss? Probably the answer, in our opinion, is there is a significant changes in the enteroencephalic endocrine axis that may really explain why we have a change in appetite control, glucose and lipid metabolism, insulin homeostasis, and gastrointestinal motility. Definitely, we know from several studies that, Roux-en-Y's gastric bypass significantly alters the GI hormone production. Bypassing the duodenum and also the majority of the stomach, we induce change in ghrelin and GIP. Also accelerating transit of undigested or partially digested food to the ileum, we induce change in GLP-1 and PYY. My lab has been really focused on ileal brake. We believe really in the end-gut theory, where essentially, because you have a small pouch, you bypass part of jejunum, you have essentially partially digested food accessing the ileum. In the ileum, there is several cells that produce GLP-1 and PYY, and we know that PYY is very responsible for decreased food intake, and GLP-1 is responsible for decreased gastric motility, gastric emptying, also decreased intestinal transit. PYY is a member of the neuropeptide Y family. It's secreted by the gut mucosa, and especially in response to a meal, and is a powerful appetite suppressant. The GLP-1 is produced by the L cells in the distal bowel and colon, and is one of the most substance that induce secretion of insulin. That is called the incretin effect. That is responsible why some of these patients can resolve diabetes in the first few days after surgery. But also GLP-1 through the vagal pathway alters the gastric acid secretion, the gastric emptying, and also the intestinal motility. In our study, we hypothesized that bypassing part of the jejunum and increasing nutrient delivery to the distal small bowel, Roux-en-Y gastric bypass result in increased postprandial response in GLP-1 and PYY compared with a group of obese control treated with a similar caloric restriction. Also, our secondary hypothesis that high-fat meal compared with a mixed meal result in a greater postprandial response of GLP-1 and PYY. In our study, we consider patient, very homogeneous group. Patient with class 2-3 obesity, with type 2 diabetes. They're not taking insulin, they're not taking GLP-1 agonist, they're not taking DP4 inhibitors. And we used a matched case control study. It was not a randomized study, but we matched for BMI, age, and sex. So we have 2 groups. People are undergoing gastric bypass surgery, and people that are going to be the control. They are going to be essentially, their intervention is going to be just caloric restriction in a way similar to what bypass patients do in the first few weeks after surgery. We studied this patient with the meal stimulation test at baseline. The test is, we did two types of tests. We did one test day one with a mixed meal, essentially a balanced, meal, liquid. And the second day, high-fat meal. We took blood at baseline, 30 minutes, 60, 90, and 120 minutes after the meal. We studied, this patient with variable intervals, but all the patients stayed on the room-wide gastric bypass diet, essentially a liquid diet, 900 calories, and we matched that diet in the control group. And then we restudied this patient again, after the intervention with the same modality we use as a baseline. These are results for demographics. Our two groups are a match, like we want for gender, age, weight, and BMI. And these are results of the intervention. As you can see, the gastric bypass surgery group experienced a greater weight loss. Percent was 6.7% versus 3.5% in the group with calorie restriction. But when we adjust for day of intervention, you can see the two groups have pretty much the same percent of weight loss. Also, the change in BMI, the delta BMI, before and after intervention is not statistically significant. This is the first meal stimulation about GLP-1 with a mixed meal. You can see at the baseline, both groups bypass, that is in blue, and also control baseline that essentially is in orange. They're not very different. Essentially, there is no response in GLP-1 production after a meal, in this case, a mixed meal. And after intervention with calorie restriction, again, we see no change in the group, with the calorie restriction, but we see a significant restoration of GLP-1 response in the group with bypass, with a significant change at 30 and 60 minutes after the meal. When you talk about meal stimulation, it's very important to calculate the area under the curve with the trapezoid method. And we did this, and we compare essentially the percent change from baseline to intervention for both groups. We compared these two changes. We found that statistically significant with 0.001. When we look at GLP-1 levels after a fat meal stimulation, our hypothesis, I remember, was we have a greater response with the fat meal. We see, again, no changes with the meal stimulation, fat meal in the control group and also in the pre-op gastric bypass group. Also, that change doesn't happen also after calorie restriction in the control group, but we have a significant change again at 30 and 60 minutes in the post gastric bypass group. But definitely the two changes are very similar. We can conclude that really there is not really a big difference in fat meal versus mixed meal regarding GLP-1. And this again is the area under the curve for fat meal for GLP-1. And this again is a percent change between baseline and post-intervention for the two groups compare. And there is a statistically significant difference of 0.002. When we look at PYY level after mixed meal stimulation, the two groups, there is a slight difference between the two groups, but again, a baseline, but not really statistically significant. And after calorie restriction, the control group has not changed compared with baseline, but in the post-gastric bypass group, we see a significant change of a PYY level at 30 and 60 minutes after a meal. And this is also shown in the area under the curve analysis, when we have essentially a difference between the two groups in delta percent of 0.02. If you look at a level of PYY after fat meal stimulation, we have definitely a different, a little difference between the pre-op bypass and also the control baseline, but that was not statistically significant. But what we saw again was a major increase in the gastric bypass group of PYY response after a fat meal. In this case, we have a significant difference at 30, 60, 90 minutes compared with the control calorie restriction. And it was also shown in the area under curve analysis for PYY after a fat meal, where the delta percent change between the two groups was 0.01%. Because we had different weight loss in the two groups, we had to see if the weight loss was essentially a covariate or a confounding factor. This is why we did a regression analysis And we plot essentially percent of weight loss with area under the curve for GLP-1 and PYY. In the first two figures on the top, we plot weight loss versus a GLP-1, mixed meal, and GLP-1 after fat meal. We find a significant correlation between percent of weight loss and level of GLP-1 expressed as area under the curve. That means essentially the GLP-1 response correlate very well with the percent of weight loss. Regarding the PYY, we found no correlation between percent of weight loss for both the mixed and the fat meal. Then we can conclude essentially that an increased postprandial PYY response, especially after a high-fat meal, is present in a gastric bypass patient as compared with the age, sex, and BMI-matched control patient treated with a similar calorie restriction. Regarding GLP-1, we know there is a significant change in the gastric bypass surgery group, but that change is definitely correlate very well with the percent of weight loss. Also, we observed that, really, at this point, the greater changes in PYY and GLP-1 can be the one responsible for what we observe every day in our patient, essentially early satiety, prolonged satiety, and really, that mechanism makes them really lose weight more than just restricting, caloric intake. I want to acknowledge also SAGES for providing support with the SAGES Research Grant Award to Dr. Evans for this study. Thank you very much.
That's a beautiful, thought-provoking study. I think if anyone has questions for Dr. Torquati, we have to ask you to ask them in the back of the room because we're going to move on to the Storz lecture. So thank you very much.
Thank you.